Okay, so, sorry, I have to go back to where we left off. Let's see, was 23, congestive heart failure. Okay, so congestive heart failure is a syndrome characterized by myocardial dysfunction that leads to diminished cardiac output or abnormal circulatory congestion. Congestive heart failure can occur as two independent failures. Someone can have congestive heart failure on just their left side or just their right side. However, because the heart functions as a closed unit, like it's one unit, both pumps really have to be functioning properly in order for the heart to be efficient. So just because one side is malfunctioning, it'll affect the whole heart. So the syndrome, the dysfunction can lead to diminished cardiac output, like we said, which can present itself as tachycardia, ventricular dilation, enlargement of the heart muscle. And the etiology is arteriosclerosis. That word always trips my tongue up. Hypertensive cardiovascular disease, valvular heart disease, pericarditis, circulatory overload, or coronary heart disease. Medical treatment involves removing the cause of the problem, which could be various things. So it could be working on, lowering cholesterol, or if there's hypertension or whatever, if there's a valve disease. So some of these things can be treated independently, therefore improving the congestive heart failure. Reducing physical activity may have to happen initially. Of course, if somebody gets stable and healthy, they want to incorporate physical activity into their lives, but this is more of a immediate treatments. Drug therapy such as diuretics and digitalis. So closely monitored by the physician is generally a patient that comes in that's kind of heavy breathing, tends to get winded very easily, and that sort of thing. They're going to be under the close care of a physician. If they're stable, there's really no major alterations to dental hygiene care. Some considerations or causative factors would be hypertension, valvular heart disease, coronary heart disease, or a heart attack, MI. If a patient is taking digitalis, we do have to watch them for more susceptibility to gagging because they are more prone to nausea and vomiting during dental procedures. So we want to be more aware of those procedures that could cause gagging. In those patients, we want to take extra care. If the patient, like I said, comes in, they get winded super easily, they have very difficult time breathing, then those patients should be seated more upright. We really should not put them back as far. Let's see, patients who have left-sided heart failure have difficulty receiving oxygenated blood from the lungs, resulting in increased fluid and blood in the lungs. And this is going to cause that dyspnea on exertion, that shortness of breath on lying back, the coughing, and more expectoration or productive cough. And these patients tend to require maybe an extra pillow when they sleep, so they may want something like that in the dental chair, and they can't be placed back as far. So if they have failure more on the right side, it's associated with the blood return from the body resulting in systemic venous congestion and peripheral edema. So maybe they're swelling in their legs, that sort of thing. Patients with right-sided heart failure have foot and ankle edema and often complain of cold hands and feet. So they sort of manifest or express themselves differently, whether or not they have right or left congestive heart failure. We want to minimize their stress and discomfort. We want to find out, what we can do to make their appointment more comfortable and stress-free. And then, as always, nutritional counseling is warranted, talking about reducing sodium intake. And then we might need to consider, although this probably is rare and a lot of people don't use their air powder polisher too regularly, but then again, there are going to be people who love it and who use it on a regular basis. So being aware of the sodium bicarbonate, if they're on especially if they're on a sodium restricted diet. Congestive heart failure and dental hygiene care. I think this is a little bit of what we already talked about: positioning patient upright, limit ultrasonic instrumentation use or high use, or using high-speed suction to avoid avoid limiting ultrasonic or use the high-speed suction, which now we know, ever since COVID, we always use our high-speed suction to avoid unnecessary fluid accumulation in the throat. The fluid reduction minimizes the patient anxiety and their difficulty breathing. So if they feel like their back of their throat's filling up with water, even if it's a normal amount that most people can tolerate, but for a patient with congestive heart failure, it will add to their anxiety because they're already potentially struggling to get good breaths. And then recommend nutritional counseling to decrease sodium intake. And then moving on to congenital heart disease. So congenital heart disease is an abnormality of the heart's structure and function caused by abnormal or disordered heart development before birth. Commonly observed congenital heart malformations are ventricular septal defects, atrial septal defects, and patent ductus arteriosus. Those are the three. So a ventricular septal defect is an opening in the septum between the ventricles that allows for oxygenated blood to flow from the right to the left to the right ventricle. It may repair on its own if it's very small, or if it's very small, if it's small or large, surgery may be warranted. If it's large, surgery is probably very definitely warranted. Left untreated, it can lead to death from secondary cardiovascular complications. So unless it's very small and repairs itself, surgery is always warranted. Atrial septal defect. So an atrial septal defect is an opening between the left and the right atria. Blood volume overload eventually causes the right atrium to enlarge and the right ventricle to dilate. Patients may be asymptomatic. Patient may feel fatigued, shortness of breath, or upon mild exertion. Those may come once symptoms do start to show themselves. And then again, surgery to repair the defect. Then the patent ductus arteriosus. My gosh, some of these words. Most common congenital heart defect found in adults, and it is a failure of the vessel to close. It's more common in premature babies, but it can also occur in full-term births. Treatment includes drug therapy, catheter-based procedures, and surgery to close the defect. And then the last one, which is the most rare and complex congenital heart defect, and it's associated with cyanosis, is Tetralogy of Fallot. The defect is composed of 4 congenital abnormalities. That would be the ventricular septal defect, the pulmonary stenosis, right ventricular hypertrophy, and malposition of the aorta. So there is a lot going on with this particular defect. The treatment includes measures to relieve the cyanosis and palliative and corrective surgery. So they would probably be in for several surgeries to correct the heart defects. Dental hygiene care, pre-med for residual defects following repair, palliative shunts, and first 6 months after surgery. So oftentimes these are where our pre-meds start to come into play. Management of any cardiovascular complications such as congestive heart failure or dysrhythmias resulting from the defect. So there's different medications they may be on. Consult with a physician about surgeries, medications, and their overall medical status and their need for pre-med if you have any questions at all. Let's see. So, just reading through my notes here. And I'm going to pause it. It's starting to rain, and I don't want the rain to pick up on the mic. Hold on just a sec. Okay, so let's see. The individual with congenital heart disease does not require extensive alterations in care. We already kind of talked about that. However, the American Heart Association does recommend prophylactic antibiotics before dental hygiene procedures to prevent infective endocarditis in persons with residual defects following a repair. So if they've gone into surgery and there's still some kind of a defect, with unrepaired cyanotic congenital heart defects, including palliative shunts, and during the first 6 months after surgery. We talked about that. Secondary concerns focus on the management of other complications such as congestive heart failure, dysrhythmias. We talked about that as well. Okay, I always have 2 sets of notes, and I want to make sure I cover it all. Let's see. Okay, I'm going to stop there, and then we'll do our last video with valvular heart defects. We'll kind of continue on talking about that.